Hello, my name is Andrew Mihalache, and I'm excited to present my work entitled Dosing and Delivery Methods of Steroids for Diabetic Macular Edema and Macular Edema Secondary to Retinal Vein Occlusion, a Systematic Review and Meta-Analysis. I would like to thank the COSIG Selection Committee as well as my co-authors for their diligent support on this project. Our conflicts of interest can be found listed in the bottom right corner of the presentation. In this project, we aim to assess the comparative safety and efficacy of different doses and delivery methods of steroids for diabetic macular edema and macular edema secondary to retinal vein occlusion. We performed a systematic literature search on Ovid Medline, Embase, and Cochrane Central from January 2005 to November 2021. We included randomized control trials reporting on efficacy and safety outcomes stratified either by dose or by delivery methods for steroid injections in DME and ME secondary to RVO. We used Cochrane's Risk of Bias Tool 2 to assess the risk of bias of included studies, and grade recommendations were used to assess the certainty of evidence. Overall, 16 RCTs reporting on 3,708 eyes at baseline were included into our meta-analysis. We found that changes in best corrected visual acuity from baseline were similar between 1 mg and 4 mg intravitreal triamcinolone acetonide, as well as between 2 mg and 4 mg IVTA. 8 mg IVTA, however, was associated with a significantly better final best corrected visual acuity than 4 mg IVTA. Patients treated with 4 mg IVTA also had a significantly higher incidence of cataract surgery, as well as increased IOP compared to 1 mg IVTA. Final best corrected visual acuity and retinal thickness were similar between IVTA and the delivery method of subtenon triamcinolone acetonide. And ultimately, changes in retinal thickness were similar between 0.35 mg and 0.7 mg intravitreal dexamethasone. Overall, the RCT evidence in this setting is currently limited for nuanced treatment decision-making in DME and ME secondary to RVO. Our meta-analysis found that high-dose IVTA of 8 mg was associated with a better final best corrected visual acuity. However, comparisons in efficacy between 1 mg to 4 mg were similar. We also found that 4 mg IVTA may have a less favorable safety profile than 1 mg IVTA, given its higher incidence of cataract and increased IOP. Ultimately, our meta-analysis found no significant differences between the different delivery methods of triamcinolone acetonide, being intravitreal delivery or subtenon injection of triamcinolone acetonide. Thank you so much for watching my presentation, and I really appreciate your time.